Welcome to a Derm and an Allergist walk into a bar. The only bar where the drinks are optional, but the sneezes, hives, and skin problems are always on the menu. I'm Dr. Martin Smith, board-certified allergist.
And I'm Dr. Taylor Bullock, board-certified dermatologist. Together, we share stories from the clinic about patients and conditions at the fascinating crossroads of skin, allergy, and immunity.
So pull up a chair, order your favorite metaphorical cocktail, and join us as we dive into the wild, weird, and wonderful world of skin and allergy. What is the weirdest thing someone has ever come to see you about?
There's this disorder called Morgellons disease that patients will tell us that they swear that they'll have dog hairs or human hairs just buried inside their skin. One patient that I had, she came in, was just picking at her skin everywhere, and she swore that her dog's hair was just trapped under her skin everywhere. But this is the real kicker. She brought in her 6-month-old.
Oh no.
And her 6-month-old did have quite a few spots on her where you could tell mom had been picking.
Oh.
And where's the weirdest place that people get an allergic reaction?
Like you, people show me a lot of rashes, right? I see eyelid dermatitis from nail polish, belly buttons with contact dermatitis from nickel in the belt buckle. I see some rashes down there from latex or even anaphylaxis from it.
We've talked about this many times, but the amount of patients that come in thinking that they're safe from having an allergic reaction because they've used a product or used something their whole life and never had a reaction, right?
Exactly. Getting those patients to believe that their beloved shampoo that they've been using for 15 years has got MCI in that they're now allergic to, they don't believe it because they think the longer they use it, the more it shows that they're tolerant to it.
So just to clarify, for everyone listening, in case we weren't clear enough, even if you've used something, a sunscreen, a shampoo, whatever it may be, if you've been using it for your whole entire life, at the drop of a dime, you can become allergic to this, just like that, and then all of a sudden not tolerate it anymore.
And once you're allergic to one skincare ingredient, your risk exponentially increases to become allergic to more.
And Neosporin, I swear, Neosporin is a ticking time bomb. Someone will be using it one day, it's just boom, all of a sudden, huge reaction. I mean, reaction that makes you hurt just looking at it. It's unbelievable the rash you can get from it.
I've seen that, and I mean, it's because we're putting Neosporin on an open wound. They say on the packaging, don't put what we know what people are using Neosporin for. Your skin barrier is not only compromised, it's basically gone, and then you're putting a highly allergenic antibiotic on there and thinking that you're not going to react to it.
It reminds me, the amount of times that I've been consulted in the hospital to go see a post-operative, post-surgical wound that is the consult's for infection, but despite every antibiotic in the world, it's not healing. I can already assume, all right, the surgeon tried to use Neosporin
Exactly.
after the surgery, and the Neosporin is causing a huge allergic reaction. And the funny thing is many of the surgeons won't even believe me, but it really just takes some common sense to think about it. None of the antibiotics are working. It looks like an allergic reaction. That's what's going on. And the patient will say, oh, I've always tolerated Neosporin just fine.
And I've seen it in those post-surgical cases where they think that whatever they apply on top, like the dressing, they're having a contact dermatitis from the glue around the dressing. I'm like, think of the Neosporin that's actually right on the wound.
Totally.